everyone, my name is Tiana. I'm the case manager today. How about we go and introduce ourselves?
Well, I'm Mariah. I'm from physical therapy.
I'm Rachel. I'm from nursing.
And I'm Allie. I'm from occupational therapy.
Okay. So the patient today is Hugh. He is in his early 50s, also a retired veteran. Currently living with his wife, and he's also from Grand Rapids, Minnesota. And so he is looking for services in outpatient settings. So how about we go and talk a little bit about him? So tell me about your assessments with him.
So what we got from Hugh was that his main complaint for physical therapy is his neck pain and his overall joint pain. He says he attributes this from carrying heavy loads and having headgear in the military. His pain is in the posterior aspect of his neck, and it's described as searing, and it's affecting his ability to drive for long periods of time, participate in his hobbies, and to sleep.
Okay.
For occupational therapy, overall he seems very aware of his situation and in times of anxiety knows what strategies he uses to calm himself, but he does experience severe anxiety in situations in which he's out of control. And he also experiences some sleep disturbances, only getting about 6 hours of sleep a night. That's broken.
And in addition to his back and joint pain, he does report respiratory distress that he attributes to his time in Iraq with the burning pits. And in addition to this, he also complains of bowel problems, which include loose stools, constipation, and some bouts of incontinence as well. And we also want to stay on top of his pain management and interventions as well.
Okay, so what's the current situation looking like right now?
So currently the patient is stable and unchanging. He doesn't have any recent changes that are of concern except possibly his gastrointestinal issues. His prognosis for future treatment is good based off of his primary complaint and his medical history. And he also is seeking OT to establish normalcy in his everyday life, reducing his anxiety in those situations where he feels out of control.
Okay, and then do we have any safety concerns regarding?
Our main concern right now is the amount of ibuprofen he's taking daily, as well as his history of PTSD and substance abuse.
Okay, what about his background? Sorry.
He does have a history of opioid and alcohol abuse. Currently he does smoke about 3-4 packs of cigarettes a day. He has a history of PTSD, anxiety, GI problems, and an undiagnosed pulmonary disturbances. The current medications he takes is the 2,400 milligrams of ibuprofen a day, loperamide, albuterol, and an antidepressant. He currently does not have any relative family history.
Okay, and then what are the current actions that we are providing?
So the actions that we're going to be taking is appropriate consultation because he seemed confused about multiple diagnoses that he has.
Okay.
Pain management because his pain seems to be a little out of control at the moment. And then education on his current medications and taking excessive amounts of that ibuprofen.
Okay, and then what's our timeline looking at right now?
The patient should be referred immediately to a pharmacist for a consultation on medication use. And his other complaints are not urgent, but they will be addressed as well.
Okay, and then who is the ownership of this case?
We, as his primary providers, will continue following his case.
Okay, what is our recommendations?
Our recommendation is to refer Hugh to a pharmacist and collaborate with them and the primary care provider about his medications because we are concerned about his ibuprofen guidelines and adverse effects on his GI tract. Nursing will also assess his social support system and assess his furthering symptoms as this case goes along and advocating for this patient as well as teaching.
Okay.
We will include social work if the need does arise.
Okay.
And physical therapy would like to see him for an objective examination to determine a plan of care for him for his neck and joint pain.
Okay.
And occupational therapy will be teaching him some additional coping strategies to use, as well as exploring non-pharmacological interventions to manage his pain.
Okay, good job. Thank you.